thanks for joining me today and agreeing to do this interview. It's very much appreciated. I wanted to start off with asking you if you could describe what you think of as the IPFR process to me.
Yeah, sure. Well, for me, it's used in scenarios where we come across a patient who has essentially exhausted all existing licensed treatments, and that could be, I guess, chemotherapy, immunotherapy, radiotherapy. And, we're looking to find a treatment that, yes, there may not be strong evidence for, not to the point where we've got good randomized controlled trials, but there is some evidence to suggest it may be benefit to that patient. And there could be something unique about that patient that would make that treatment, more suitable for them. So the IPFR process is used in that scenario to try and seek funding for that proposed treatment, and that's to seek funding via the health board on an individual patient situation, so specifically to that one patient you've got in front of you. So that's how I understand it.
Fantastic, thank you. Do you consider using the IPFR process for one of your patients?
Well, personally, I probably have two scenarios. So it could be a patient that's maybe exhausted all systemic treatment options. So for me, a common use of the IPFR is someone with metastatic cancer. They've used up a lot of their chemotherapy standard treatments, and it's often things like immunotherapy. It may not be licensed in that treatment site. There may not be as I say, the large randomized controlled trials, but there is small trials to show its benefit. So I'd use it then. Another scenario is I specialize in something called stereotactic radiotherapy, which is a more modern form of radiotherapy delivering high doses in a very accurate way, and that is currently funded through WISC, and they have a very strict eligibility criteria. So there may be patients where they don't quite fulfill that criteria, but I still feel it was a very good option. So I would use the IPFR process for those patients too. So it's not all just about drugs, it can be radiotherapy too.
So how do you find in general completing the form? What do you think of the form?
I think the form is fine. I think the first time you do it, it can be a challenge. There's a lot of information you've got to provide. So, the problem is our jobs are very busy, and it's finding the time to complete them sometimes. And, that sounds ridiculous to say that, we wouldn't do a form just because we haven't got time. And often, we're having to do these in our own time. So they are quite long-winded, but what I have found is that once you've done one, you can almost use that as a template of doing it again in the future. So, the first time I did one, it probably took me a few hours, but now I could probably do one in, 20 minutes, just because I can use my experience from previous forms. So it's just trying to pull all the information that's required for that form, all the previous treatments, what makes that patient unique, the evidence, and then some of the other challenging bits can be sort of trying to find the costings, which I know Valindra Pharmacy helped me with the drug ones, and I've got contacts now in finance to help me with radiotherapy ones. So yeah, it can be a task, a significant task, but it's certainly, I found it's got easier and easier the more I do.
So essentially familiarity has helped enormously. Is there anything about the form you'd change if you could? Is there anything you'd add or take away or alter in any way, do you think?
It's hard for me to comment on that because I suppose it's the panel that needs the information. So, I assume that the IPFR panel were involved in creating the form, and what they've put on there they feel is required. So yeah, I think that would probably be a question for them. I think trying to make it as succinct and precise as possible would be my preference.
If we move on to your role within the IPFR process, in terms of your role for the patient, what kind of information do you think your patient needs from you when you're going to submit an IPFR for them?
I think this is probably quite a challenging bit, and sometimes the IPFR panel probably just see a form and what's written on there, but what they don't see is how challenging the interactions can be for the clinician with the patient. Often we're faced with a patient that's, if we're going down the IPFR panel, the patient is often very desperate. So it's often a very emotionally charged consultation. It might be that they've been, Googling new drugs, and they've discovered about immunotherapy and they want to try it, and then you're telling them, well, it's not currently funded for your indication, it could help, and there's this process and a panel will decide yes or no whether you can have it. And for a patient that can be quite tough to hear. So you've got to be quite sensitive to the patient and how you talk to them about this process. You've got to be honest in terms of managing their expectations. They can put a lot of hope into it. It's a lot of pressure for the clinician to make sure the form is as good as it can be to maximize their chances. So I think the key role for the clinician, I suppose, is that communication with the patient, making sure that we're empathetic to their situation, we're honest with them, support them, and give them the feedback as soon as we get it regarding the decision making. So yeah, it's not easy, that bit.
No, absolutely. Do you ever feel pressurized to submit an IPFR because they've perhaps read things on the internet and maybe their expectations are a little higher than you would expect? You ever been in that situation where you felt, well, I'm submitting this, but I'm really not sure?
Yeah, definitely. I guess I do pride myself on being able to articulate with patients, what I generally think the pros and cons and the benefits of treatments are, and I tend to be very honest with them. And if I genuinely think, this is a waste of time, this treatment's not going to help you, you need to focus on your quality of life, I will stress that. But I think every patient deals with their diagnosis differently, and for some they just can't bear to not fight the cancer.
Yeah.
I think sometimes it can be a bigger step for a patient to go from that transition from always having a treatment fighting the cancer and move into a more palliative care approach. They can struggle, and so you do definitely feel that pressure. I'd like to think though that I wouldn't just do an IPFR just for the sake of appeasing a patient psychologically. I have to feel that genuinely it's the right thing to do. But it's hard. Yeah, it's certainly a challenge.
No, I can imagine, absolutely. So I guess similar to the patient role, then, what do you think your role is in terms of for the panel? What's your responsibility? What information do you think they need from you?
I guess the panel have to be sure that I have considered all the standard of care alternatives. Is there potential to re-challenge with chemotherapy again? Instead of stereotactic radiotherapy, could I give standard radiotherapy? So I think the panel need to be reassured that I have explored all other options and really this is what I feel is the best thing for the patient. I think the panel want to be sure that I've reviewed all the up-to-date evidence. That's always a very much an evolving picture and can change as the months go by. And I've articulated well that there's something about that patient, something unique, something that would make them potentially benefit from what I'm proposing.
Do you find the communication between yourself and the IPFR team and in the past, could this have been better, and if so, how? So
It's always been impeccable, I have to say. You know, once there's a decision, I get a prompt email to say, yes, we've approved it, or no, we haven't. So I don't think it's ever been an issue. I think most healthcare professionals use their NHS email quite robustly, look at it frequently. So getting it via email, I think, is the best way, rather than waiting for any letters in the post. So I would say that the system works exceptionally well.
No, that's good to hear. Do you feel that you get sufficient information following the panel meeting on the decision? I guess particularly in those cases where perhaps it's declined. Do you feel that you've enough information to understand the rationale for their decision?
Yeah, you know, we always get a nice detailed letter explaining that, and to be honest, those ones that are declined are probably ones that I were expecting to be declined, and the reasons usually that are given probably sit very comfortably with me, and that was probably what I was thinking deep down. So I think, yeah, the messages that come back are very clear, to the point, and are fair. So yeah, I would say the feedback's it's perfect.
Oh, that's good to hear. So the next one's to do with outcome data. As part of any IPFR decision, there's a requirement to provide outcome data. So is that something you would routinely provide? How do you find getting that information in the first place? Is it relatively easy? You know, in terms of then providing that information, is that process okay, or could it be improved?
Yeah, I guess one thing is I'm not sure how robust the request for that information is. I can recall in fact, I've had one recently, an email from someone within the panel, I assume, asking for an outcome for a patient, but I don't remember having many of those over the years.
Okay.
And finding out the outcome is, you know, straightforward, because we do so few. We always tend to remember that patient quite well, and it might be that either yes, the patient's still on treatment going well, or they've sadly passed away. So I think it's not a challenge to give the feedback. It's just I'm not sure whether we are being asked for the outcomes regularly.
Okay. Right. Okay, that's really useful to know, and that's something we can take back to the group. What are your overall impressions of the IPFR process?
Yeah, no, I have to say I'm positive about the whole process. You know, it's worked very well for me over the years. I've had a lot of success with it. You know, there will be times where the panels say no, and that can be hard and can leave you in a real sticky situation with the patient, and can have to have a difficult conversation. But yeah, no, I have to say overall that the process is efficient, feedback is quick, and I would say the decisions are fair. So I guess maybe one thing I maybe don't understand is there's obviously different IPFRs in each health board. Within those health board panels, are there similar, are they the same people, or all completely different people? And is there a risk that different health boards could very much give different answers to the same scenario, and how do IPFR sort of deal with that?
Sure. So there's the IPFR policy, which everyone has to adhere to, and within that there's terms of reference for each of the panels. So they have to be made up of certain types of individuals from each health board. We also have a quality assurance process for IPFRs. So we take a collection of cases from each panel. We do one every quarter from each panel, and we assess it against criteria from the policy to make sure that they're following due process. Obviously, if they're following the correct process, then you would assume that all things being equal, that the decision making should be similar. Obviously, patients, as you said, are all completely different, so there's lots of different rationale as to why you may approve a treatment in one place but maybe not in another, because there's something about the difference about the patients that means that it's suitable for one, perhaps not another. So, but there's those sort of processes behind to try and reduce the risk of there being differences in terms of decision making, but it's not an exact science, is it? And it will depend on people in the room, I guess. But
Sure.
yeah, the other reason you're being interviewed today is because we have an annual workshop that we run for our IPFR panels, and it's open to clinicians as well to attend who complete IPFRs, and we do training at the workshop to try and help with these sorts of issues, you know, to try and help with that consistency of approach. Thank you so much for today. I really appreciate that, Tam. That's been
No problem.
fantastic.